Hi everyone, happy Friday. Hope you're doing well. It's really gorgeous outside, so coming to you live from outside for this Instagram live today. Today we're going to be discussing stigma around sexual health in the Black community, and just getting into some things we've heard over the years, some practices that are best in terms of making sure that you are getting tested regularly. We're also going to talk about the Black church, which should be a pretty interesting conversation, so please tune on in, and we'll be sharing a lot of information. Just gonna wait for my co-host to get in the room and then we'll get started. What's up? Thanks for the folks joining and being part of the space today. But during the COVID-19 pandemic, Whitman-Walker's Community Health Department has, hey Corey, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platforms. So we cover various topics around STIs, HIV, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you, and my name is Jewel, and I use she, hers pronouns.
Hey Joel, give me 1 second. I don't know my email is still having trouble.
No worries.
They
I'm also
locked
waiting
me
for
out.
Walker to get in the room. Can you hear me okay?
Yeah, I can hear you.
Okay, cool. Like, if not, I'll use
Yeah, I
these
can hear
headphones,
you.
but preferably I won't. Cool, and
Yeah,
Walker's
I'm not
here.
sure what's going on. It's done this so many times.
Hey, I'm just gonna text you a link real quick and see if that works.
Okay, yeah, because it keeps locking me out of the email. I've been having this problem for a couple of
But
days.
yeah, today we're going to be discussing sexual health and stigma in the Black community,
Okay, good,
and
that
just kind
works.
of going over some of the various ways in which that stigma affects how people engage with sexual health and engage or don't engage with sexual health. So we'll get started in a second. There's a lot of background noises. All right. How's your week been,
Okay,
Corey?
it's been good. Let me pull this back up. All right, let's get started. Okay, so my name is Corey, and I use he, him pronouns. And Jewel and I work to bring educational Instagram live spaces. We're Whitman Walker's community health team. Today, I'm going to discuss stigma around sexual health in the Black community. Let's define stigma. Google Dictionary and Oxford Languages define stigma as a mark of disgrace associated with a particular circumstance, quality, or person. We can also see stigma as poor perceptions and perspectives that inaccurately ignite fear, slander, and shame on particular communities. A 2014 article published through NIH's National Library of Medicine titled Sexually Transmitted Infections Related to Stigma and Shame Among African American Male Youth Implications of Testing Practices, Partner Notifications, and Treatment shares the following findings. STI-related stigma and shame common in this population of African American male youth could undermine STI testing, treatment, and partner notification programs. So, aside with living through stigma, we can see that published research documents the negative impact um, it can have on sexual health and, in turn, public health. Let's also provide a working definition of sexual health. The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive or respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable or safe sexual experiences, free of co- I don't
Free of
know,
coercion.
yeah, fear of coercion, discrimination, and violence.
So, with those working definitions that Corey just shared, sexual health is more than getting tested and STIs, and it's more than just having sex. It's healthy attitudes and behaviors and practices around sexual health relationships. And that said, consent is sexual health. Not being emotionally dependent on a sexual relationship is sexual health. Knowing how to safely engage in sex for pleasure and or reproductive reasons or to avoid pregnancy is sexual health. And being introduced to sex at an age where you can emotionally, socially, and physically engage with sex in a healthy way is sexual health. However, often we find that in many communities, including Black and African communities, we just look at sex as boiling down to the physical act or just being about the physical act. So I always love to share that one of my earliest introductions in terms of sexual health and sex was in my sixth grade health class in my middle school with an amazing educator named Mrs. Wright. And so she walks into class that day and she goes, "Y'all, sex is so good when it's with the person you love." And so for me, that really set the tone and pace for how I would grow and like look at sexual relationships and what they could be beyond the physical act. Corey, is there a favorite introduction of yours that you had when it came to getting introduced to sexual health?
Yes, it was actually with my PE teacher, Coach Grissett. Um, I think I was in eighth grade. I think I was in eighth grade. Coach Grissett, she came in, um, and she was like, "Yeah, so today y'all are young adults, and we have to have this talk." And then she was like, "You know what we're gonna talk about today? Sex." And then it was like, you know how we were still, I don't think we were mature enough, I guess, still at the age. Everybody was acting crazy, but it was still one of those things that she broke it down in a way that it made us understand that sex can be a positive thing or it can be a negative thing. And that's what stuck with me the most.
Thanks for sharing that.
Yes, thank you as well. Um, so let's talk about sex education avoidance. Many young people and adults go through life without sex education that uses prevalence and accurate anatomy, names, or prevention practices that include all the types of sex people might engage in. Often we hear of absence only sex education, overly heterosexual sex education and anti-LGBTQ sex education, where young people mostly learn how to not get pregnant or avoid having sex because if they'll get pregnant. This approach allows for increased transmission of STIs and an increase of in unplanned pregnancy. This past week, a news story came out about a 40-year-old man in Germany who was diagnosed with HIV, monkeypox, and syphilis at the same time. His nose was rotting on his face. This is medically shown of necrosis and it is irreversible. But age at age four at age 40, this man has never been tested for STIs. If you are a sexually active person, it is important to get tested every 3 to 6 months. If you're not afraid to have sex, you cannot be afraid to get tested.
Again, for the people in the back, if you're not afraid to have sex, you cannot be afraid to get
Afraid
tested.
to get
So if
tested,
you're sexually
right?
active, please get tested and make it part of your healthcare routine. Let's talk about modern African culture and sex. A lot of African cultures are sex positive in the way that many people have active sexual lives, and that's whether it's within or outside of marriage. It could also be if they are part of a culture that is inclusive of having multiple wives or multiple marital partners. However, a lot of African cultures do not proactively or accurately provide sex education to young people at home or even to adults when they're older. And so we're kind of not letting these people learn how to stay safe and sexually healthy when they're engaging in sex because it's a taboo topic or people see it as taboo. We also have a lot of anti-LGBTQ beliefs when it comes to relationships and sex in modern African cultures, and I emphasize modern African cultures because I think hopefully a lot of us have seen that video that circulated on social media a while back where this person was giving us a rundown of the history of same-sex relationships in Africa that were documented and going on without stigma, without people having laws against it, and that was all before colonization and European countries started to come and steal people and implant their beliefs on African countries and people. So that said, modern African cultures today, there's some countries that adopt the don't ask, don't tell kind of policy to queer communities, where as long as you're kind of flying under the radar. People won't really bother you. But there's also countries that will punish folks for being LGBTQ with imprisonment or death. Uh, Recently, I saw a video on social media where an African woman, likely in her 40s or 50s, had been having sexual relations with a man. She referred to this man as a demon and said that she got an STI from him. And she described the demon as having oral sex and insertive sex with her. She then started experiencing itching in her private parts, and she approached her pastor at her church to be cured and prayed over. And surely enough, that pastor passionately prayed over her and prayed over her oral sex and insertive sex demon. Personally, I'm still praying that this video was a parody and just meant to make us all laugh. But that is not always the case. And so it very well may have been real or hopefully fake again. But please, if you are experiencing symptoms of an STI like itching or burning or blood in your urine or yellow or green discharge or cottage cheese like discharge or any changes in smells, it's important that you seek medical attention. Go get that STI test, as STIs cannot be prayed away. It's just not a thing
Not
that
at all.
happens.
It does not happen. On the topic of church, let's talk about the Black church. During many centuries of ongoing oppression, slavery, racism, and the like, the Black church has served as a beacon of hope and unwavering faith for so many Black and African American people. The Black church can be a place of communion, chosen family, spiritual growth, and worship. And it can also be a place of homophobia, minimalizing the realities of sex and lust. This can be true of many religious spaces or community spaces for gathering. But this practice can breed opportunities for misinformation around sex and reproductive health. Churches and religious institutions can be beautiful and healing spaces and can simultaneously be places where sexual relationships are discouraged when preached about, yet engaged in secret. But the end of the day, But at the end of the day, church is the place to treat. It is not the place to treat or cure STIs, but it can be a place where accurate sexual health information, resources like condoms and barriers, and locations for getting tested are shared. It can also be a place where education around the symptoms of STIs, HIV prevention tools like PrEP and PEP, and pregnancy planning tools like birth control and abstinence are shared. Congregations can better save their communities by not shaming people for engaging in sex, but by making sure that if folks are engaging in sex anyways, they can do so with all of the correct information or resources to protect their sexual health.
Thank you. A word on how churches can be more helpful for sexual health. So as we wrap up our live today, I wanted to share an interesting finding about Black youth, sex, and mental health. A 2017 journal article published through NIH's National Library of Medicine titled Addressing Unmet Sexual Health Needs Among Black Adolescents with Mental Health Illnesses shares the following recommendation. Given disproportionate HIV disease burden among Given the disproportionate HIV's burden among Black adolescents, alongside increased sexual risk behaviors among Black adolescents with mental illnesses, culturally relevant and situated interventions are essential. Partnerships with stakeholders in non-traditional settings embedded within the community, like inpatient and outpatient mental health treatment programs, can enhance sexual health dialogue and prevention efforts with underserved groups. So I think all in all, they're saying that, given the increase in mental health awareness and practices, it presents another space in the area that we can intervene and provide sexual health education and engagement for young people, so that as they grow older and continue to engage in sexual health relationships or sexual relationships that we want to be healthy, they can do so with more resources and information in their tool belts.
Yeah, thank you for taking the time to learn a little bit more about sexual health stigma in the Black community. We hope that you leave this space and go get tested. Getting tested for HIV and STIs is the first step in anyone's HIV prevention and sexual health journey. Depending on a person's sexual health practice and activity, getting tested every 3 to 6 months can go a long way in preventing HIV and STIs. Untreated STIs make it easier to become positive to HIV. So it's important to get tested. You can learn more about Whitman-Walker health testing, hours and location at whitmanwalker.org /testing. HIV and STI testing are available by appointment at Whitman-Walker's locations. Call 202-797-4439 to schedule a testing appointment, and be sure to check our websites for most up-to-date hours. Of course, but before we go, we're going to give you a few reminders about COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and our communities from illness. Multiple variants have soared across the world, and it's totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify that folks around you are vaccinated. Make sure that you keep on staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has the COVID-19 vaccine available. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us, for DC residents, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. For Maryland residents, learn more about the Maryland vaccination distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. For Virginia residents, learn more about the Virginia vaccination distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you consider getting the vaccine, discuss COVID precautionary measures with those around you, and be mindful of masks and keeping your distance. But especially when you do not know if a person has been vaccinated or not.
Thank you for that, Corey. And of course, we're actually battling another public health pandemic right now. It's called monkeypox or mpox. So if you're in DC, you can pre-register for an mpox vaccine appointment at dchealth.dc.gov /monkeypox, or just visit DC Health and look up monkeypox. If you're in Virginia, they're currently working with local care providers to contact, trace, and identify those most in need of the monkeypox vaccine. And then varying counties in Maryland are allowing residents to pre-register for a monkeypox vaccination appointment. So please just, wherever you are in the world, visit your state or your country's local health department for more information about how to register and get vaccinated against mpox. In DC, as of Friday, August 5th, they've got walk-up vaccine locations available from noon until 8 p.m. So they actually just opened up. This might be a great time to go get in line so that you're out of that line fast enough. But vaccines are available while supplies last, and the vaccine locations include 3640 Martin Luther King Jr. Avenue Southeast in Ward 8, 7530 Georgia Avenue Northwest in Ward 4, and 1900 I Street Northwest in Ward 2. Again, walk-up vaccines are available first come, first served, and are available to eligible residents who have not already received a first dose of the mpox vaccine. Now, you're currently eligible to be vaccinated in DC if you are a District of Columbia resident who's 18 years or older and you identify as a part of any sexual orientation or gender, but you've had multiple sex partners in the past 2 weeks, including those, and this includes people who are already considered high risk for getting mpox, so anyone who's part of the LGBTQ community, or anyone who identifies as a man who has sex with other men, a transgender man or a transgender woman, or if you identify as a sex worker or any sexual orientation or gender, or if you're a staff at any sexual orientation or gender at establishments where sexual activity occurs, like bathhouses, saunas, and sex clubs. Again, you'll need to prove that you're a DC resident, so you'll need to use an identification card with a DC address, a utility bill or other piece of mail with your name and DC address on it, or a current DC lease or mortgage with your name on it. But thank you all again for learning about sexual health, stigma, and safety in the Black community, and for learning about mpox vaccines and COVID-19 vaccines. Please follow our Whitman-Walker family at Whitman-Walker on Facebook, Instagram, and Twitter. And you can check our website out for resources at whitman-walker.org, and then also follow our family accounts at realtalkdc_ and at nofilterdc. Wishing you all a beautiful weekend and happy Friday.